So, hi, I'm Ben. um, I'm one of the embryologists at Demeter Fertility. I also run the donor program. So basically, there are some faces in here that would know me, um, but I've been with Demeter for 8 years now. About 5 of that was in the lab, and I've been involved in the donor process since then. In regard to the clinic, we were established in 2009 by Dr. Knight. Won plenty of awards in that time. I think our most recent was 2024 as Sydney's best fertility clinic. So that's pretty cool. We are a small team, and we have four clinicians. So Dr. Knight's our medical director, and you'll see him there on the left. Then we've got Dr. Wanada, Dr. Rahampana, and Dr. Bashadi. So over 3 or 4 different sites. So a couple in Hurstville, Liverpool, and the Northern Beaches. So there's definitely access over Sydney. Our donor program. Basically, we were the first donor program in Sydney. We started in 2010. We've worked with all the major donor banks at this point. If they're not on the list for us at the moment, we, weren't confident in either the eggs or the price, or, it just wasn't working with us. So the donor banks that we do have on hand at the moment are all people we're very confident in the gametes that they're providing and the service to you guys, as well as, cost and shipping and, their flexibility to help us, because sometimes, patients do require that little bit extra, and we want to make sure that that gets through to you guys. So we don't have any barriers to entry. Basically, if you're interested in using donor, we'll help you find a donor, through one of the banks. There's no wait lists, there's no extra costs. So anything that we discuss either tonight or in a consult with me or one of the doctors, you'll get all the costs up front. There's nothing that we're hiding in the back end, which I think is pretty good. We do charge a one-off donor admin fee, and that covers off basically all the help that we give, as well as the organizing of shipments and legal requirements, things like that. But the longest step in this would be picking a donor. Once you've selected a donor and we've ticked it off, it does take about 2 to 3 weeks to get them shipped over. But before that, the only real wait time is making sure that you're comfortable with the donor that you've picked, answering any questions, and really being clear with what's happening. So, donor sperm, I guess a good place to start. So we work with a few banks, they're listed on the screen. So Overgene, Origin, World Egg and Sperm Bank, Seattle Sperm Bank, European Sperm Bank. Donor sperm usually starts at about $2,000. It's a relatively straightforward process, like I said. So we'd send you to the donor bank's websites, go on, make an account, find a donor that suits you. We check things like genetics, and we look at the quality of the sperm, make sure it's all up to scratch, and yeah, it gets shipped in. So, and treatment can basically start immediately once it arrives, depending what we're doing. So yeah, like I said, no wait lists, and we're good to go. So donor sperm's nice and straightforward. Donor eggs. So very similar thing, no wait list. We use Overgene, the World Egg and Sperm Bank, Donor Nexus, Central, and Genesis. So the World Egg and Sperm Bank and Donor Nexus are American banks. Overgene and Central are both Eastern European, and Genesis is primarily an Asian donor bank. So Cost-wise, starts at about 6,000 US dollars. You'll find most things for donor are in US dollars, so that's something to keep in mind. But it starts at about $6,000 for 6 eggs. Each bank will then, increase that depending how many eggs, or if they're a premium proven donor, so a donor that's got associated pregnancies or higher education, things like that. And basically, the donors aren't paid for their eggs. They are compensated in regard to medical costs, testing, things like that. But they're under New South Wales law, they are not compensated. So the other thing that's probably really important to know is a guarantee. So donor banks will offer a guarantee, so that hypothetically they have a thaw rate of 80% or 1 blastocyst per 6 eggs purchased. Now this is to cover you if something does, we don't get the outcome that we want, whether the quality of the egg was no good for thawing, or they didn't grow on to that day 5 and make a blastocyst. You're covered there. It is advised that you do specifically speak to the donor bank about that, though. Each bank is different, and we like to be very clear about that when we are going through that. So definitely something to keep in mind. So legal requirements. New South Wales is quite strict, but that is a good thing for you, the patient. Basically, both donor and recipient will undergo NZCA counselling. So that's why not every donor on a donor list from a bank is available to Australia. They are subject to a specialised counselling. And then in New South Wales, there's something called the 5-family limit. So basically, a donor can have 5 pregnancies associated to 5 different families in New South Wales, and then they're not able to be used again in New South Wales. So if you have a child with that donor and there's 5 families, you can continue to, because you're one of those families, but we wouldn't offer that donor in as a new person, to another family, to a 6th family. And once a child is born, we provide the information of the donor to the New South Wales Central Registry. So that information is not specifically for you, the parent, but if the child at 18 wants to find out about the donor, if they'd like to get some contact information, they're able to do that. Or in very extreme circumstances, if your child is requiring medical treatment that could be linked to something genetic, they will, or with a family history, your treating doctors are able to get that donor's information for that. Now, finally, something that is people should be very aware of is we don't move donor material between clinics. It's our responsibility to keep track of the family limits. So if you do purchase a donor through Demeter, that material stays in our cryo, but we won't be moving that to other clinics. So that's definitely something as well I think people need to be aware of. The process for donor, like I said, pretty straightforward. So a doctor's consult would be between $220 and $500. Medicare will give you about $70, $80 back on that. Then once you've seen your doctor, you're happy to go ahead with the clinic, you have a consult with me. I introduce you to the donor banks, kind of point you in the right direction of what bank might fit what you need, as well as run through things in a bit more detail than we do tonight. Once we've had a bit of back and forward, you've chosen a donor, you've paid the donor bank, done your counselling, there may be a requirement of genetic screening. So if your donor has had screening before and they've come back with a positive of as a carrier to a genetic condition, we'd have your partner or yourself tested depending on what kind of gamete you're using, just to make sure that we're not introducing 2 copies of that gene into the genetic pool. But yeah, from there, once you've paid, signed contracts, it usually takes, like I said, about 3 weeks to get gametes into the country and into the clinic. And from there, usually a week to 2 weeks, if I've already got frozen eggs, to do a fertilization, or we can start your cycle on your day 1. So it is a pretty straightforward process. You've got me there the whole time to run you through anything, as well as Jennifer, my colleague and scientific director. She's the boss, but she's also available to help out when I'm not around. You can get access to those donor banks after the initial consult with the doctor. But other than that, yeah, it's not too many steps involved. So we like to make it as easy as we can. Now, let's have a look. If you've got any questions, definitely pop them into the chat. I've got a couple here, but I don't want to miss anybody's. So just the few that I have at the moment. Okay, so awesome. So there's a couple questions around eligibility, which I think we covered a little bit earlier, but like I said, no criteria for access at Demeter: age, weight, orientation, even being a single woman. No stress. As long as you've seen one of our doctors, we'll facilitate access to the bank and get you the right service. What else do we have here? Okay, we've also got one about surrogacy. So that's not something that we offer at Demeter. We are a smaller clinic. The legal implications for surrogacy are probably a bit too demanding for us. So we, focus on what we do, kind of thing. Okay, that's another good one as well. So there's a question here about being interstate. So that's not an issue. In regards to legalities, you would, and this one specifically about being from Melbourne. So basically, you would be subject to the laws that the fertility clinic is in. So if you were coming from Melbourne to New South Wales, you would be under the New South Wales Code of Practice for donor. So the 5 family limit would be relevant to you. But in regard to treatment for interstate people, something we do, I'd say a good chunk of our patients are interstate, with a few international as well. Basically, we need to see you for collections. Everything else can be done through Zoom or over the phone. We'd have you do your blood work and scans locally and get those results in. But yeah, not too difficult working outside of the state, because realistically we need to see you for collections and transfers. The rest of it can be done remotely, which is something we spend most of our time doing now as well. So I think that's really good for you guys. Let's see. I am seeing a few questions about specific treatment types, like ovarian PRP, thickening of uterine lining, low dose FSH, even a stem cell question in there. So we do offer all of these treatments. They are specific to each individual, so I wouldn't specifically speak about them tonight, but it's definitely something that we talk to one of the doctors, so you would speak to one of the doctors about, or if you had some initial questions, we can definitely organize a consult with a nurse, no cost, and they can run through the individual procedures with you to see if, number one, it's suitable treatment for you, and if you know it's going to get the outcome that you want. So any other questions? I'll give it a couple minutes. So just pop those in the chat if you have them. Okay, if there are no other questions, I'll wrap it up. I don't want to take up everyone's time. But if you did want to make an appointment, you can email us through at hello@Demeter Fertility or give us a call on 1300 899 850. Or scan that QR code. If you have specific donor questions, absolutely book in an appointment with me. I'd love to speak with you and see if we can't help out. Questions about treatment, book in with the head of nursing, Christine. She'll be able to run through how we treat patients in regard to you know, treatment types and whether they're useful to you or not. Oh, okay, so we do have a couple other questions, so I'll get through those. Counseling elsewhere. So basically, that's fine as long as they're an NZICA counsellor. We will accept their report. We have our counsellor, his name's Ian, run over it, make sure it ticks all the boxes for New South Wales. But yeah, counselling elsewhere is fine. That's not an issue. People do jump clinics, and that's, you know, make life as easy as we can for you. The other one is embryo creation at the donor bank. So we can do that, absolutely. It's something that's becoming more and more common. So basically what would happen is you would provide a sperm sample at Demeter, we'd freeze it, ship it over to the donor bank. They would create embryos over there and ship back the embryo, the frozen embryo, instead of an egg. So it can be a little bit more expensive, but you are guaranteed to get, you know, however many embryos you purchase, kind of thing. Whereas if you're purchasing eggs, you know, hypothetically you buy 6 eggs, you might get 3 that get frozen at day 5 at blastocyst stage. But you know, there's a little bit more unknown there. So both options are valid, and we can facilitate either one. Not a real problem there. Let's have a look here. Okay, everyone. Look, if there's no more questions, I'm happy to wrap things up. But definitely, if you have anything else that you wanted to discuss or didn't feel comfortable putting in the question thread, make an appointment. More than happy to sit down and have a chat, see if we can't help out. So thank you everyone for joining tonight, and hopefully we speak soon. Bye.